As I've mentioned in other areas, my main thrust has been robotic surgery and cancer surgery. I think I'm well suited to support people in the setting of cancer, and I'm well suited to do important big operations. I've also always had a big interest in reconstructive urology. And what that largely means to a urologist is the most common areas where we would reconstruct things would be urethral strictures, or strictures of the ureter, which is the tube that connects the kidney to the bladder, or Peyronie's disease surgeries. With regards to urethral reconstruction, the most common thing that someone would have is just a scar in their urethra in a certain location. Usually we will go ahead and treat that with a very minor scope procedure. But the problem with urethral strictures in general is that recurrence tends to be the rule. So sometimes it's good news for someone to find out that they have an answer as to why they're urinating poorly or they're dribbling, and we can tell them it's because there's a narrowing in your urine channel or your urethra. And it's a very easy procedure for me to fix that with a scope, but it recurs at least 50% of the time. In each town, there will usually be 2 or 3 urologists that do urethral reconstruction, and I'm one of them in the DC metropolitan area. I, like most contemporary surgeons, have gone through, myself being in practice for 20 years, I have lived through the eras of different ways to do urethral reconstruction, which is called urethroplasty. These days, by far the most common thing, and certainly the thing that I do, is employing something called a buccal mucosa graft, where we've learned that the best possible material to reconstruct your urethra with is the lining of your cheek. It's actually a simpler procedure than it used to be. And whereas somebody that recurs after a scope procedure is going to have recurrence 90% of the time, somebody that finally gets it fixed, which is what a urethroplasty would be, is going to only recur maybe 5% of the time or 3% of the time. So we have a great fix. These are people that commonly have had 6 or 7 procedures elsewhere, and I find it very gratifying to finally show them that there's someone around that can fix that for them and it will be solved, and that journey of constant recurrence and constant procedures is about to be over for them.